I'm joined today by Dr. Sikos, a colleague of mine that I've been associated with for many years. He has been proudly housed on H Gentleman's article, The Best Surgeons in the World, for a number of years, because I feel he provides a great level of service to a number of patients that I've interacted with. And I felt it really important to allow people to get connected with him and wanted to have him on today to discuss with him the involvement that he has with me, and essentially the fact that he is such a great provider to people in the corner of the world that he resides. And wanted to say, welcome, Doc. Thanks for coming on. And, please give me a bit of insight into your clinic and how you have found being involved with what I do and essentially patient education, and how that has been seen in your clinic with patients that have come to you.
Okay, hi, Specs. I'm very happy to being here. Thank you for the invitation and being the member of your very, very effective and very informative company, may I say, what you present. First of all, your involvement in how to inform the public about the hair transplant industry, the dangers and the possibilities is really outstanding, and I'm just very thankful for it, because it's really a great effort to help for us, for the doctors, how to treat patients. So when they then come to me, they already know your work, your commitment about your own journey as well. And this is a great help when we inform the patient, when we consult with the patient, and we can have a basis we can count on.
So are you finding, Doc, that essentially a much more educated patient? My information
that's very
coming
important. That's very important, because it's less work for us to having an educated patient, already educated patient.
Well, the objective of the service that I provide is to put patients in touch with ethical surgeons. And so that when they find those ethical surgeons, they're also educated and do the heavy lifting, because I want to put patients in touch with doctors such as yourself. And it's important for me to know that those patients are then going to be guided accurately, despite the fact I've done the heavy lifting to help them get educated. That's only the start of it. What is vital is that then from that point on, they are truly getting guided in the right direction and in a safe direction by skillful and ethical surgeons such as yourself.
Yeah,
And, I've seen your work.
true. That's fully true. And actually, this is the mutual interest it brought us together to deal with the patient in a very ethical way, and not only professional way, but ethical as well. Because we can work on, for instance, young patients very professionally, but sometimes it's more challenging than it looks like. It's really according to our nowadays regenerative therapies and medical therapy possibilities. It's really a great responsibility for the doctors, and also for you as well, how to educate the public when and how to get into the surgery, and how to avoid it in case, of course.
Indeed. And I'm working with surgeons like yourself. It's a team effort to help educate and guide patients in the right direction, so they get the information from every angle that is ethical and is honest.
Yeah.
And you've been a leader in the field for many years.
Yeah.
And it's an honor to be able to kind of work with you and point people in that safe direction to you.
Especially through the era of the black market surgeries, when patients are not educated enough, or unfortunately they are not interested being educated as well, and they are getting into any kind of intervention. I don't want to call them surgeries either, which end up with some disaster. So it's pretty
Indeed, Doc. So tell us, where are you located? Because I would love the patients to know that are watching exactly where you're located and
Yeah.
how can they get in contact with you to
Okay.
gain a consultation to see if they are an eligible candidate for surgery.
Yeah, that's a very important thing to make a first decision how to decide if the patient is eligible for surgery or not. We are located in Budapest, in Hungary, the capital of Hungary. Very reachable, may I say, because it's contact. It's very easy to us.
Mhm.
First, we have a nice website and patient can introduce themselves or sending photos through the website, and we can provide them free of charge an evaluation, and when they are familiar with it and they like it, then they can get a consultation, either personal or online as well. So then they can decide whether to go to for the surgery or not, or do they need any more other information or evaluation, or they can adjust everything with us.
Mm. I've interacted with a number of patients over the years. I've lost track of the number of patients that I know I have put in touch with you and have then been guided accurately with regards to their eligibility and even been told by you that they aren't an eligible candidate for surgery. And also the patients that have been to you to have surgery, the feedback has been quite remarkable, very
Thank
positive
you.
with regards to overall, not just the results, but how they were kind of dealt with and how they were treated as a patient, as a bespoke patient,
Try
and
to
not.
do our best, of course.
Yeah, well, clearly you do. So tell me a little bit, Doc, about your protocols in terms of, do you perform both FUT surgery and FUE surgery? And tell me a little bit more about your opinion and approach to candidates that, as we are finding, patients generally only want FUE surgery. But what is your opinion on providing patients and educating patients with what they need and not necessarily what they want?
We are working in the head transplant industry for more than 30 years. So we are quite experienced and trained as well. Not only me, but my fellow doctors, because I have some doctors working with me, and also my assistant team. The techs are very, very professional and very trained staff we have. Also, yes, we do FUT surgery mainly for women. We provided it for mainly for women how to avoid the hair shave. But nowadays, it's the interest for that kind of strip surgery and the linear scar is very, very limited. Patient they don't want that linear scar unless it's even we can provide it for them, and it's a good surgery still. I think so, but the most of the patient they like to have the FUE surgery because the scars are less conspicuous, and actually yes, we can provide them a very nice donor site after surgery or even after two surgeries. Scars are nicely hidden and very nice dots only cannot be seen. Also, we provide so-called no shave FUE without shaving at all. I'm really not a great enthusiastic for the long hair FUE, but we can do some. The interest for that kind of solution is very limited in our area. But no shave is a different thing. That means it's still an FUE surgery without any shaving. Not in the recipient or at the donor side.
Mm,
And it's a good occasion, but it takes longer time. So usually an extended no shave takes 2 days surgery.
right.
Most of our surgeries are 1 day surgery. We can provide 3,500 grafts, which is a reasonable number. We don't want to fight with the with the public how to provide 10,000 grafts or something. This is because it's a different thing. I don't want to get in deep in this topic now, but it's a reasonable number. And for extended the baldness, we can do even 4,500 grafts in 2 days when the donor site is
Mm,
the density is enough, and still we are able to keep the hairy appearance nicely at the donor site, which is a very important issue, how to avoid over harvesting at the donor. And also it takes 2 days when we perform that high number of grafts. So we have a lot of surgeries, a lot of service. We also do a lot of beard surgery, or we do beard grafts for the hair as well when the donor side is limited. We do finger surgeries, scar revision surgeries, hairline lowering for females, and also we do some so-called pro bono surgeries for injured patient when it's possible, how to cover scars or operation scars or traumatic scars, for instance, burn injuries. So we can.
I have a question for you. Obviously, you're one of the leaders in the field. You provide an extensive range of surgeries, i.e. FUT, FUE, which is predominantly the main surgery that you offer. You've mentioned there you do long hair FUE, scar repair, you do female hairline lowering, a variety of different surgeries based on your vast 30 years experience in the field. So the biggest question people will want to know is, how much does surgery cost with you? How much is FUE surgery per graft with you? Because this is the most influential factor we find.
As an average number, 2,500, okay, grafts. The basic price is around 4,000 euro, but it have some plus and minus as well in different circumstances extra. So that's the price we count. The FUT surgery for 2,000 grafts is about 3,700, or that's the level of our surgeries. The exception is the no shave, because it's more expensive. It's more time and work consuming surgery. So it can be done, for instance, 2,000, 7,000.
Good. Well, it's incredibly, and the point I wanted to raise there is, given your geographic location, you're priced very competitively within this industry. Obviously, I deal with a lot of patients that travel all over the world to different surgeons, including yourself. It's always been a positive kind of component of patients wanting to come for you for surgery, because not only are they getting an incredibly high level of service, one of the best surgeons in the world, essentially, they're getting it at a very affordable price. And that's a key point I want people to be made aware of, is the affordability. Because as you well know, Turkey and the black market of people essentially deciding to go for surgery is very heavily influenced by cost. And I just think it's important, in light of that, that patients that are watching this do actually realize that you could actually have one of the best surgeons in the world performing surgery on you at an incredibly competitive price, especially compared to the Turkish price point. So I think that's a really important point. But Doc, I think what I'd really like patients to know, and you have been a part of what I do at SpexHair, and you've been a part of Ape Gentleman's article, The Best Hair Transplant Surgeons in the World, which I think you are a testimony to what that article is all about. And that article is all about education and providing patients the right information to provide them a platform to do their own due diligence and their own research. And that essentially it's not more about a list of surgeons, it's about providing a cross spectrum of surgeons who are highly ethical all around the world, to enable people to get in touch with the right resources and the right surgeons, to be led in the right direction, to get educated and informed. And would you agree with that, that your involvement with the likes of myself at SpexHair and Ape Gentleman has provided patients a safe place to get educated and informed with regards to this surgery?
Totally agree with you. And I think the transplant community could be very grateful for your commitment and for your work in this field. As I told before, it's a great help for the patient and great help for the doctors as well.
Fantastic. Well, Doc, I really appreciate your time today. You know, we will definitely do another recording again and enable patients to find out more information about your clinic and you and the types of surgeries that you provide them.
Anytime, my pleasure.